to address the myriad of underlying causes of inflammation sets the person up for failure. Sometimes we'll hear about treatment-resistant depression, and in my opinion, a lot of times that's thrown around when people don't respond, by doctors, for example, when people don't respond to an antidepressant. Well, their depression is treatment-resistant. No, it's not. Maybe serotonin wasn't their problem. Maybe something else. They've actually done studies and found that only about 40% of people have any meaningful response to antidepressant medications. Wow, that means 60% they take an antidepressant medication. The doctor says, oh, you're not getting better, you're treatment resistant. No, it means you're treating the wrong thing probably, but I digress. Treatment-resistant depression is often seen in people whose treatment has been unifactorial. Go to the doctor, get a pill. Go to a therapist, address your thoughts. But we're not looking at the big picture. And failure to consider all of the potential domains, including those that perpetuate inflammation, really prevents the person from reaching their highest quality of life and best level of recovery. Diverging a little bit from depression, resistance. It's a word that I love and hate at the same time. It is shorthand, but too often it is used critically or to pathologize something that is going on in treatment. This client is resistant to treatment. Well, when you're working with somebody with depression, sometimes they feel like they just can't. And you're like, well, just can't what, doc? They just can't anything. I can't get out of bed. I can't take a shower. I can't put two thoughts together. Anything you ask me to do right now, I just can't. I'm doing good to be conscious and breathing. And that's not an exaggeration. People with significant major depressive disorder are exhausted. Part of this is due to the physiological alterations underpinning the symptoms. Other causes of resistance, especially to treatment, doing what we, quote, ask them to do, or what we think they, quote, should be doing. Why aren't they doing these things? Well, they may not feel like they can. They lack self-efficacy. It's like, well, why should I try to change this? Because I'm not going to be able to make it any better. They may have lack of buy-in to the process. If we're asking them to do something like practice mindfulness meditation in the morning, afternoon, and evening, if they don't understand why, what's the purpose, what's the function, how is this going to help me, they may not have a whole lot of buy-in. They may be too overwhelmed to even start doing anything, which goes back to the I just can't. I'm too overwhelmed. I've got this grief. I've got these feelings. I've got these thoughts. I don't have any energy. I can't. They may not know where to start. Do I start by changing my sleep? Do I start by addressing my issues with my mother? Where do I start to address? I don't even know where to start, what to do. And this is where we can be really helpful as clinicians. We can help people break it down into small, very small, manageable micro goals. They may lack the skills to do what we're asking. If we ask them to pause and think before acting, well, that sounds super easy to do. But a lot of people lack the skills to pause. They go straight from flat to furious, and there is no thinking time in between. So asking them before they start raging to stop and think about whether that's the best reaction, not helpful. They probably don't have the skills to do that right now, or guess what? They probably would be. And they may have difficulty translating skills into abilities. What somebody can do when they're calm and in session is very different than what they're going to remember to do when they're stressed out in daily life.